Dear Chief Executive, dear Dr. Caroline Semaï, dear ladies and gentlemen, dear representative of Rencontre de Santé Publique, dear heads of services and public agent of the state, dear representatives of the Organization Committee of Paris 2024, dear ladies and gentlemen, dear health professionals, researchers and teachers, dear experts and specialists who came from France, but also Guyana, but also Sweden, Denmark, Ireland, United Kingdom, or Japan, dear representatives of the OECD, ladies and gentlemen. And what was dear to my heart today, despite the circumstances of the countries, to honor my commitment to be among you today in this beautiful site and venue of Beffroi de Montrouge to participate to the Rencontre de Santé Publique France 2024. And I really wanted to thank you for your invitation. I'm all the more proud to be among you today that, to my knowledge, I'm the only minister in charge of sport to speak before you. Thank you. The full commitment of your institution needs to be underlined for causes that are important to us.
En signant ensemble une convention de partenariat.
And we will sign a partnership agreement together. And our discussions is the demonstration that at last we're moving the lines on sports and education, sports and health, two words that are very important when they are put together. This is the scientific meeting in terms of public health and gathers health professionals, educators, and sports teachers, and that offer a large venue for important issues related to regular sports activity. We also have the scientific approach dimension to this issue. We talked about the most efficient policies to increase PA, how to adjust this sports practice in terms of with regards to climate change, how is it conducive to prevention of diseases, how large sports events can convey the right messages of public health. With the willingness to join, not to pay only lip service, but to put money where your mouth is. We just did a few minutes of yoga exercises, and I would like to thank Mrs. Mélandagno to have helped us and to have moderated this exercise. And I would like to thank the chief executive of the French Federation of Table Tennis, who came all the way here for this event and who's offering some entertainment time on table tennis so as to promote this sport to prevent Parkinson's disease. Health and sport go hand in hand together, and every day we see it with our policy implementation measures. It's all the more obvious that these two worlds have the same common values: commitment, the concern for the other individuals, solidarity. These are common values that I would like to recall in the world that we live in today. The President of the Republic decided for this year, 2024, to name it a major national cause. Physical activity is a major national cause. This is why it has this certification, as you see on the top left-hand side.
Santé Publique France soit un partenaire.
And Santé Publique France is an eminent partner of this major national cause to help us to make sure that we move the lines further, because there's so much to do on this subject, sports and health. We have a common commitment that is ours with our ministry, and it takes the shape of a partnership agreement that will help us to respond to two important issues. First, to make sure that there's consistency between our policies and measures to promote regular physical activity. And the second one is to convey a message in an unprecedented way in France as abroad. This partnership agreement tackles a wide number of subjects. First, prevention of diseases. We'll have a video on the benefits and of physical activity that will be displayed in a large number of pharmacies. And then we also have some work done on communication program targeted onto teenagers and adults, but there will be also communication from the Ministry of Sports to those that are more far from physical activity practice. And we'll have also a reshuffling of the website mangerbouger.fr, and that will be enriched with new messages on promotion of sports and physical activity. And then we'll have the publication of scientific data on the level of physical activity of the French population that will be highlighted under the limelight in our website related to the Major National Cause 2024. I would like to pay tribute to the work done by yourself, your Chief of Staff, Mrs. Almarie Alikite, and all your co-workers for their availability, because this was highlighted to me by my whole team. And also the action of your communication officer, Mrs. Peggy Pogins-Kalman, and the organizer of this event, Rencontre de Public France. Towards this major national cause and this partnership agreement, there will be two challenges that we are currently trying to face and overcome together. The first is to try to draw upon this opportunity to organize these Olympic Games, this first Summer Olympic Games, the first Paralympic summer, the first Summer Paralympic Games, so as to lay emphasis on sports and its benefits, self-esteem, and to instill it in our young population age group. But the aim is also to show that it is highly necessary to promote sport, and each and every one of us is convinced that it is important to raise awareness of this urgency for health purposes that sedentariness represents. It has been deteriorated by the growing exposure to screens and TV, especially amongst the teenagers and young people between the age group of 6 to 17 years of age. They spend 4 hours and a half during school time in front of screens, and they do not make more than 20 minutes of physical activity. This phenomenon can be seen among adults as well. Let's be aware of that. We adults are sitting 12 hours working per working day, 9 hours per non-working days, and we spend, all of us, 3 hours a day in front of a screen beyond our professional activity per se. These behaviors are tangible nowadays, whereas at the beginning of the 60s, our children would run around 800 meters in 3 minutes. It's now 4 minutes that they need to run an 800-meter run. And the High National Authority for Health consider that we are in health vulnerability because we are too much sedentary in our way of life, and it has an impact on diseases, and we do not have enough physical activity. But we should not sink into a pessimistic point of view. I will give you 2 good pieces of news. When we practice sport again, when we resume physical activity, our physical condition improves, and it improves swiftly. And I will go back to the expression of François Carré. We should reverse the curve. We should reverse the trend. And there was a study carried out by academicians in 2022. After 6 weeks of training, the teenagers' conditions improves by 5%. With there's a breath capacity, a breath lung capacity that improves by 5% to 8%. It reduces disease causes of pathology from 15 to 50%. Cardiovascular diseases, I was talking about it, but also type 2 diabetes. And this physical activity improves the response to treatment and strongly reduces relapses. So this is to stop and curb sedentariness and to promote physical activity that we will convey this program, that we will execute this program around three main objectives. First, to promote physical activity among adults, to induce them to sport up, to move at least 30 minutes a day. That corresponds, as I recall it, to the standard recommended by the OECD, but also within the health nutrition program as launched since in 2022. 30 minutes is straightforward. It's simple, it's easy, each according to our own preferences, at our own pace, according to our means and possibilities. But this can change everything if we can incorporate it into our daily lives. Also, to mobilize all the sports agents and all the resources, elected representatives, health professionals, companies, startups, event organizers, the cultural world as well, to promote these values and to put sports at the heart and center of our activities and centers of interest. More than 5,000 events are organized or will be organized throughout all our territories for the sake of this major national cause. Thanks to the success of this certification, more than 200 events were organized in our territory. And at the national level, we have a health sports agenda that is quite busy, with races organized with PS educators, with pupils, but we also have the 4-man go race. We also have Ready Go program among 20 cities of France for this during the summer. It's also Bouge ton camping program among 4,000 camping sites for people on holiday during the summer. And it's also the sport for hospital-admitted patients. Another objective is to place sports at the heart of our public policies and for the Republican Pact. And this is why it is important to highlight the mobilization of all the major stakeholders of our health system. And then we know how much expertise is there and how much important they are. I said that there would be two good news. The institutions that you represent, thanks to the momentum that is entertained by this certification, we manage little by little to move the lines. We have national days that took place last week in Vichy, and that allowed us to confirm that 600 health national centers have been reached as an objective. That was one of our objectives among all our cities. 2,000 patients as well. That is twofold what we had the previous year. We are the drivers of physical activity for this, and we give the right nudge, and we promote it among all the networks, may it be health professionals, sports agents, to help people to get into sports activity that is suitable to them. There's also another commitment that is ours collectively, jointly, with a France en Forme National Day that was organized on the 10th of April and on the 4th of June. We would mobilize all the stakeholders for this important awareness campaign with debates as we had this morning, as you will have this afternoon and tomorrow. And at the same time, we'll have physical activity sessions along the side as side events, so that we always put our money where our mouth is. There's also the matter about sickness benefits. We have a sickness benefits partnership agreement that could be overshadowed by all the other events. We have unprecedented events like a specific event with the GPs, the specialist doctors that take care of long-term of patients under long term, but also physiotherapists, nurses, midwives. And in December 2024, we are dealing with the prescription of APA and the promotion of this health sports network. We have thousands of co-workers working on the insurance, the sickness insurance also, so that they show the way, and they also play the role of models as well. As to physical activity, we talked also about how to pay for suitable physical activity, and there was a report that was published last summer. As to the crucial subject of APA, the context of elections is such that I cannot speak at length on the subject. However, I would like to share two convictions. First of all, that the state services really want to execute all the provisions for 2024, aiming at enrolling and facilitating the resort to APA. And the paying for this will be reached. It is unavoidable. And I would like to pick up on what was said earlier, because it generates savings that are important, that are significant, and we're starting now to show it in relationship with the impact that it can have on the healthcare expenditure. This is profitable for the community, and these are not expenditure only. This has a beneficial impact. I would like to renew my thanks. Thank you. Thank you to help us build these important, indispensable bridgeways between health and sport, so as to improve and protect the health of our citizens. This is the legacy of the Olympic and Paralympic Games. This is the usefulness of such an event. And this is why it is a major national cause, and this can help make it viable over the long term, and it can make it so thanks to your daily action, thanks to your support, thanks to your research and your analysis. This project can make that a way to fight against diseases, to curb this scourge of the daily life. This is why, thanks to all of you, we will manage to overcome this challenge, and we'll have solid foundations and with common and shared values. This will be a trigger for huge change in behavior for the sake of well-being and prevention, but also to make France a sporting nation, because it has all the capacity to do so. And this summer, more than ever, we will have to reach that goal and to be a nation via sport. Thank you.